Hello, I'm Dr. Greg Nelson, one of the medical directors at Midland Care. Part of my job is working with hospice patients and families, but another part of my job is in what's called palliative care, a medical specialty that I guess works with patients and families upstream from hospice. And so we get to meet a lot of patients who don't have terminal illnesses, but they're pretty sick. And one of our jobs, in addition to helping them feel as well as they can, is to talk to them about what's called advanced directives, which today, National Healthcare Decision Day, is an important time to think about it. Back in the old days, not even that long ago, back in the 1930s, 1940s, 1950s, medicine was pretty simple. We didn't have a lot of machines. If somebody was in an end-of-life situation, there wasn't that much we could do anyway except keep somebody comfortable. But now it's a lot different. We have all kinds of technology, all kinds of machines. You walk in the ICU at the hospital and you say you're visiting a patient, you know exactly what I mean. They've got everything possible that they can hook somebody up to, which is great and it's wonderful, and we're so proud of our healthcare system. But guess what? If you really are in an end-of-life situation and you haven't made your wishes known to your family and your loved ones, you show up in the emergency room and things start to happen, and before you know it, you could wind up on a breathing machine, on life support, getting very uncomfortable treatments that you never imagined and never thought about. And sometimes people who somehow miraculously recover from that say, if I'd had any idea this was going to happen to me, I would have talked to my family way ahead of time and made sure that this didn't happen. So this is a good day to think about that, and the most important thing is not talking to your doctor, interestingly enough, but to talk to your family and say, I remember when mom was sick, or I remember when grandpa was sick. They did things that I don't want, and you need to know that if I'm ever in a situation like that, I don't want this and I don't want that. I want to be kept comfortable. I want to get good medical care. And if there's something simple they can do to help me get better, great, but you may draw a line to where you wouldn't want medical practitioners to go beyond that. I guess if I imagine my dying day and I'm in bed and my family's all around me, I'd want to be pain-free and kept comfortable, my wife holding my hand, my kids around my bedside. That's the way I'd like it. Doesn't work out that way all the time, though. Sometimes it's in the ICU with a breathing tube in your throat, IVs all over the place, and machines beeping, and families that can't even visit. So that's the way it is in this COVID age. No visitors at the hospital, so imagine how hard that would have to be. But it pays to think about these situations ahead of time, so my encouragement would be to talk to your family, to think about it. Ask questions of your doctor. Not everybody thinks about this, and it's a hard thing to discuss, but get your questions answered, talk to your family, fill out a living will, fill out what's called a durable power of attorney for health care so that a person you trust can make decisions for you if you can't. That's what I would like to encourage you to start today. And if you have questions, call us here at Midland. We'd be happy to talk to you about it, even come over to your house and talk to you about it. So have a great day.